Hi there! Today let's talk about something many of us have experienced, tooth sensitivity. It's that sharp, sudden pain you feel in your teeth when you eat or drink something hot, cold, sweet or sour. But why does it happen? Let's dive in.
Tooth sensitivity.
Tooth sensitivity occurs when the protective enamel of your teeth wears down or your gums recede, exposing the underlying layer called dentin. Dentin contains tiny channels that lead to the nerves in your teeth. When these channels are exposed, hot or cold food and drinks can reach to the nerves, causing that uncomfortable sensation. There are several reasons why you might experience tooth sensitivity. One common cause is brushing too hard or using a hard bristle toothbrush, which can wear down enamel and expose dentin. Gum recession, often caused by gum disease or aggressive brushing, can also lead to sensitivity. Additionally, tooth decay, cracked teeth, and dental procedures like teeth whitening can contribute to sensitivity. The good news is tooth sensitivity can often be managed with simple changes to your oral care routine. First, switch to a soft bristle toothbrush and brush gently using a fluoride toothpaste. Consider using the sanitizing toothpaste. Avoid acidic foods and drinks that can erode enamel and try to limit consumption of sugary foods, which can contribute to decay. Communicate openly with your dentist about any sensitivity you experience. They may recommend treatments like dental bonding or fluoride varnishes to help protect your teeth. In severe cases, they might suggest a root canal or other procedures to address underlying issues. Remember, tooth sensitivity is a common issue, but it's not something you have to live with. By taking a good care of your teeth and working with your dentist, you can manage sensitivity and enjoy your favorite foods and drinks without discomfort. If you have any concerns about tooth sensitivity or other dental issues, don't hesitate to reach out to us. We're here to help.